Welcome back to the deep dive. Today, we're diving into a topic that's really personal, often quite challenging, but honestly, absolutely critical for navigating healthcare decisions. We're talking about do not resuscitate orders or, DNRs. It's a medical directive, sure, but it's really about making informed choices, your own choices about your life and care, especially, when facing serious illness or maybe nearing the end of life. For this deep dive, we've looked at quite a bit of information stuff from major healthcare accreditation bodies like JCI and NEDH here in India, and also materials that focus specifically on end-of-life care decisions. So our goal here is really to cut through any confusion, try to clarify what a DNR actually is, why it matters so much, and kind of walk through the practical steps involved. We want to pull out the key takeaways from all this material for you.
Absolutely. And it's a conversation that really touches on some core ideas in healthcare today. Things like patient autonomy, thinking about quality of life, not just quantity, and just providing clarity during what can be incredibly stressful times for families. So yeah, understanding the facts around DNRs is, I think, crucial for making choices that truly line up with your own values.
Okay, let's unpack this then. When people hear DNR, they might have a vague idea, but what's the precise medical definition according to the sources we looked at? What exactly are we talking about here?
Right. So at its most basic level, a DNR order is a formal medical instruction. You can think of it as a specific directive written right into a patient's medical plan.
And that instruction is very targeted, isn't it? It's not like saying stop all medical care.
No, absolutely not. And that's such a key point to understand. A DNR order specifically tells healthcare providers not to perform cardiopulmonary resuscitation, CPR or other kinds of advanced life support if a person's heart stops beating or they stop breathing. It's really focused on that specific moment of cardiac or respiratory arrest. It prevents interventions like chest compressions, electric shocks to the heart, or putting in a breathing tube to restart the heart, or breathing artificially.
Got it. So it's focused purely on preventing that specific, pretty aggressive set of actions right at the point of collapse.
Exactly. And it's often part of a much larger conversation about a patient's overall goals for their care. It frequently gets included in something called an advanced directive.
Ah, yes, the document outlining future wishes.
Precisely. If you can't communicate them yourself later on. It's most commonly considered for patients who have terminal illnesses or are of advanced age or have conditions that aren't reversible. And importantly, it always involves careful discussion with doctors and needs informed consent from the patient or sometimes their designated representative.
Okay, that definitely clarifies the what's. So now let's get into the why. Why is having a DNR order seen as such a critical piece of planning for many people? What's the main benefit, really?
Well, the sources point to several really powerful reasons. Probably the biggest one is patient autonomy. It lets individuals keep control over their own medical treatment decisions, specifically around end-of-life care. It's all about making sure your personal values, your priorities, are what guide the care you get, even if you're in a crisis and can't speak for yourself.
And I imagine it's also about avoiding treatments that might not actually help, or might even cause more suffering.
Exactly that. For patients with certain conditions, trying to resuscitate them might not lead to any meaningful recovery. It might just prolong the dying process, potentially causing suffering without really improving their quality of life. So a DNR helps prevent those kinds of unwanted or frankly burdensome interventions that maybe won't change the final outcome but could really diminish comfort and dignity at the end. We saw some really impactful ways of putting it in the materials. One phrase that really stuck with me was, a DNR order isn't about giving up. It's about choosing dignity, comfort, and clarity.
That's powerful.
Yeah. And another way it was framed was that it's about the quality of life, not just the extension of life. That shift in focus, from just trying to make life longer to ensuring the best possible experience in the time someone has left, that's really central to the whole idea behind a DNR.
Those are really important distinctions. And how does this clarity aspect help families? Because those moments in a crisis, they must be so chaotic and emotional.
Oh, absolutely chaotic. Having a clearly documented DNR order provides just immense clarity and guidance right when it's needed most. It takes away that awful burden of guessing what the patient would have wanted, and it can really help prevent disagreements or confusion among family members, or even between the family and the medical team. Everyone knows what the patient explicitly stated they wanted, which allows them to focus on supporting the patient according to those wishes.
Right, that makes a huge difference. So given that purpose, when does this conversation usually come up? What sorts of health situations typically lead to discussions about a DNR?
Well, the sources suggest it's commonly brought up when a patient has a condition where, frankly, The risks and the burdens of trying resuscitation seem to outweigh any potential benefit or chance of recovery. So this would include people diagnosed with a terminal illness like advanced cancer, maybe end-stage heart failure, or progressive neurological diseases.
Okay, or conditions where recovery just isn't really medically possible anymore.
Yes, exactly. Things like chronic or progressive conditions where there's no realistic hope of a meaningful recovery, severe dementia, for example, or irreversible brain damage after a really bad stroke. It's also often part of the planning conversation for older adults who might be quite frail and have multiple serious health problems, or for patients who are in an irreversible coma or what's called a vegetative state.
But it isn't only tied to a terminal diagnosis, is it?
No, not at all. It's also a conversation that needs to happen whenever a patient, regardless of their specific diagnosis, clearly expresses a wish that they don't want to undergo aggressive, life-prolonging treatments. The medical situation is always part of the picture, of course, but the patient's own preference is really paramount.
That makes sense. But just to be crystal clear, choosing a DNR isn't presented as the only right choice, is it? Some people might want everything done.
Oh, absolutely not. And that's crucial. The decision is deeply, deeply personal. Many patients and their families supporting them choose to pursue every aggressive medical treatment available with the goal of extending life for as long as possible. And that choice is equally valid and absolutely needs to be fully supported by the healthcare system. A DNR is simply one informed option on the spectrum of end-of-life care planning. It's not better or worse, just different, based on individual values and goals.
Okay, now here's where I think a lot of confusion comes in, and it's something the sources really stressed. What specifically does a DNR order stop? And just as importantly, what medical care keeps going? Because I think some people have this mistaken idea that a DNR means, like, stop all medical help.
You've hit on such a vital point there, and it's a really common misconception. A DNR order is absolutely not a signal to withdraw all medical care. Not at all. What it does cover is very specific. It prevents those resuscitation efforts. We talked about CPR, using a defibrillator, putting in a breathing tube for a ventilator, but only if the heart or breathing actually stops. It's about not artificially restarting the heart or lungs once they've failed.
Okay, so it's laser focused on those emergency life support actions at the moment of arrest. So what kind of care does continue if someone has a DNR?
Pretty much everything else that provides comfort or treats other issues.
Mm.
Patients with a DNR order still receive all sorts of medical treatments. Things like oxygen to help with breathing comfort, IV fluids if they need hydration, antibiotics to treat infections, and any other treatments aimed at managing symptoms or addressing reversible conditions that aren't related to their heart or breathing stopping.
Right.
And crucially, palliative care and pain management absolutely continue. In fact, they often become the main focus of care. Palliative care, just to clarify, is specialized medical care focused on relief from symptoms and stress of a serious illness. Its whole goal is improving quality of life for both the patient and their family.
So comfort, dignity, managing pain, managing symptoms, all of that is still very much part of the plan.
Without a doubt. Respectful nursing care, comfort measures like positioning or mouth care, making sure the patient is as comfortable and peaceful as possible. These are fundamental parts of care that always continue. A DNR is really about redirecting the goals of care towards comfort and dignity when aggressive resuscitation attempts are no longer aligned with what the patient wants or what's medically realistic for them.
That distinction feels incredibly important to grasp. Now, let's shift gears a bit to the legal side, especially here in India, which our sources touched on. What's the legal status for these kinds of advanced directives, including DNRs, in India?
Yeah, the good news on that front is that advanced directives, which include DNR decisions, are legally recognized in India. This was a really significant step, affirmed by the Indian Supreme Court in a landmark judgment back in 2018.
Okay, and what was the core of that judgment? What did it establish?
Well, it primarily dealt with the concept often termed passive euthanasia, which in this context basically refers to a person's right to refuse medical treatment, including life support, that would only artificially prolong their life without offering a cure or real recovery. The court essentially upheld an individual's fundamental right to autonomy and dignity, allowing them to make decisions about their own end-of-life care, including the refusal of life-sustaining treatment, provided certain conditions are met.
Oh, okay, so there are conditions. What needs to be in place for a DNR or another advanced directive to be considered legally valid?
Yes, there are definitely conditions. It must be based on sound medical advice, and critically, it requires informed consent. That means the patient, if they have the capacity, or their legally appointed representative if they don't, must clearly understand and agree to it. The sources also pointed out that while this legal framework exists nationally, the specific policies and procedures can sometimes vary from hospital to hospital. Hospitals often have their own specific forms for written consent and particular documentation processes you have to follow.
So it's not just about having the chat. There's a formal process, paperwork involved.
Exactly. And getting that formal documentation right is absolutely key because think about it. In an emergency situation, if a patient arrives unconscious or unable to communicate and there is no documented DNR order in their record, the doctors are ethically and legally obligated to attempt resuscitation. That's the default. The DNR provides that explicit, legally recognized instruction that allows the healthcare team to not intervene in that specific way, overriding that default obligation because it reflects the patient's documented wishes.
Okay, that really highlights just how vital it is to get this documented correctly. So walking through it practically, how does someone actually go about discussing and then formalizing a DNR decision? What are the steps the sources recommend?
Yeah, the sources really emphasize starting the conversation early. Ideally, you want to have this discussion before any major health crisis hits, when the patient is relatively stable and can think clearly and communicate their wishes without pressure.
Who should be the first point of contact? Your doctor.
Your doctor is absolutely the key person to start with. You need to have really open, honest conversations with them. Talk about your overall health, sure, but also about your values, what quality of life means to you, and what your goals would be for long-term care if things were to decline. Think about priorities. Is maximizing time the absolute most important thing? Or is prioritizing comfort, dignity, maybe avoiding being dependent on machines more important? And don't be afraid to ask really detailed questions. What would a DNR mean in my specific situation? What are the alternatives? What other care options are there?
Right.
And while ultimately it's the patient's decision, the sources strongly suggest involving trusted family members or maybe close friends in these conversations early on. It's incredibly valuable.
How so?
Well, it just helps make sure they understand your reasoning, why you're making this choice, and what your wishes actually are. That way they can support you better through the process, and importantly, they can advocate for you effectively if you ever reach a point where you can't speak for yourself.
Having those difficult conversations early certainly seems crucial. Okay, what about the actual documentation part? Making it official.
Right, so once the decision is made, it needs to be formally documented. This usually involves filling out specific forms provided by the doctor or the hospital. It's really important to review that form carefully. It's essentially your voice on paper. Make absolutely sure it accurately reflects exactly what you want and, just as importantly, what you don't want.
Signs it.
The patient signs it if they have capacity. If not, their legally designated surrogate or representative would sign. Depending on the hospital's rules or maybe local regulations, you might need a witness to sign as well, or sometimes even get it notarized. And always make sure you keep a personal copy of the signed document.
But signing the form isn't quite the end of the road, is it? Communication after it's signed seems just as important.
Absolutely vital. You're right. Once that DNR order is officially documented, you need to make sure that everyone involved in your care knows about it. That means your doctors, the nurses, any specialists, home health aides, and crucially, your family members. It needs to be placed prominently in your medical records, usually in the hospital chart, electronic health record, so it can be found quickly and easily, especially in an emergency.
What if you move between facilities?
Good point. If you're being transferred, say, from a hospital to a rehab center or going home with home care services, you need to ensure that copies of the DNR order travel with you or are sent ahead to the new care setting. And you should probably inform anyone who might be involved in emergency medical response, like local ambulance services. Although it's worth noting that policies on honoring DNRs outside of a hospital setting can sometimes vary by location.
Okay. And is this a decision that's set in stone?
Yeah.
Or can it be revisited? Can you change your mind?
Oh, yes, definitely. The sources strongly recommend periodically reevaluating your DNR order. Life circumstances change, your health status might change significantly, or even your personal preferences and values might evolve over time. So it's really important to revisit that decision with your doctor from time to time, especially if there's a major shift in your health prognosis. And if your wishes do change, make sure you update your doctor and let your loved ones know about the change as well.
This whole process, the conversation, the decision itself, it can obviously bring up some really intense emotions and complexities, especially within families. Let's touch on those ethical considerations and the family dynamics involved.
Yeah, it is undoubtedly a difficult process, not just medically, but deeply emotionally. Family members can really struggle with the idea of a DNR, Sometimes they might interpret it as giving up or just find it incredibly hard to accept, especially if their own wishes or hopes differ from the patient's choice.
So when you're navigating those tricky family dynamics, what's the guiding principle? What should take precedence?
At its heart, ethically, it really comes down to respecting the patient's autonomy. The DNR reflects the patient's decision about their own body, their own life, their own values. Their informed choices really should be honored, even when that's emotionally difficult for the people who love them. Those open, honest conversations we talked about earlier can sometimes help bridge these gaps, allowing family members to voice their feelings, their fears, but also to hopefully understand the patient's perspective and the reasoning behind their decision.
What if people are really struggling to process it all?
Well, if individuals or whole families are finding it really hard to process the emotions involved, or maybe reach a consensus, the sources definitely suggest seeking support. There are resources available. Hospital chaplains, medical social workers, sometimes counselors or ethics committees. They can provide invaluable guidance and support for everyone involved in navigating the emotional and ethical landscape of these tough decisions.
Okay, stepping back for a moment, how does this very specific topic of DNR orders fit into the kind of bigger picture of healthcare? Particularly thinking about those accreditation bodies and consulting groups that were mentioned in the sources.
That's a really important connection to make, actually. While we've been focused on the very personal decision of a DNR, this whole conversation is part of a much larger movement towards improving overall healthcare quality and patient safety. And that's exactly where organizations like Joint Commission International JCI and India's own NABH come into the picture.
Right. And what role do those organizations play?
Well, JCI is a major global player, and NABH is the leading accreditation body here in India. They basically set very rigorous standards that hospitals and other healthcare facilities have to meet to get accredited. These standards cover a huge range of things, from basics like infection control and medication safety, all the way to patient rights, ethical considerations, and the overall quality of care delivery. They essentially act as benchmarks for what constitutes high-quality, safe healthcare.
Okay. And the consultants.
Right, so consultants like Supremedic, they come in and help hospitals navigate the complexities of implementing the quality management systems they need to actually meet these tough standards and achieve accreditations like NABH. And you mentioned their blog, HospiMatch, that often discusses trends and best practices in patient care, kind of disseminating that knowledge.
So how does the DNR conversation link to that?
Well, understanding and, more importantly, respecting patient wishes, including things like advance directives and DNR orders, is absolutely fundamental to the kind of patient-centered care that these accreditation bodies and quality consultants are promoting. It's about ensuring that the care provided isn't just clinically effective and safe, but that it also truly respects the individual's values, their preferences, their dignity, even and especially in the most critical moments of life. It really underscores the idea that the patient's voice, their autonomy, is an integral part of what makes healthcare high quality.
Yeah, that makes complete sense. A top-tier healthcare system isn't just about having the latest gadgets. It's also fundamentally about honoring what the patient actually wants. Okay, so we've taken quite a deep dive today into do not resuscitate orders. We've clarified what they are, essentially, that specific directive to forego resuscitation attempts like CPR if the heart or breathing stops. We talked about why they're so important, mainly for upholding patient autonomy and aligning care with quality of life goals rather than just life extension at all costs. We looked at when these decisions typically come up, what care does continue, which is a lot, and what specifically stops. We touched on the legal standing here in India, thanks to that Supreme Court ruling. And we walked through the practical steps for discussing this, documenting it, and making sure everyone's aware.
And we also touched on the often difficult emotional and ethical dimensions, particularly for families, and how this very personal decision actually connects to the broader goals of achieving patient-centered, high-quality healthcare across the system. It is, as we've really emphasized, a deeply personal, often very complex decision, but it's one that benefits enormously from proactive thought, reflection, and clear, open communication. Ultimately, understanding these options, thinking about them, and documenting your wishes if you choose to, really helps ensure that your voice is heard and your choices are respected during potentially critical times. And that provides invaluable clarity, not just for you, but for your loved ones too.
Absolutely. So given the kind of clarity and maybe peace of mind that this sort of proactive planning, like discussing a DNR, can bring, here's maybe a final thought to leave you with. Thinking about your own future healthcare journey, what other aspects perhaps related to specific treatments you would or wouldn't want, or maybe who you'd want making decisions for you if you couldn't, what other areas could benefit from this same kind of thoughtful early planning and clear communication with your doctors and your family. Really seems like starting this conversation about a DNR often opens the door to a much broader and probably very helpful look at planning for your healthcare future.